You know that because there is a clear space around the cell. That's the lacuna. These are chondrocytes. They usually are paired in elastic cartilage. So this should be a very easy one for you. First of all, recognize the type of cell, and then look at the matrix in between. What is this? Hyaline cartilage. Hyaline look like it have no matrix, but it does. It's just that the fibers are very, very small. So it looks very homogeneous and uniform. What's this? Fibrocartilage. So your fibers are all running in one direction, as are your cells. Look at the cells carefully. You must make sure that they are chondrocytes. You must see a lacuna somewhere. Because this is smooth muscle. I didn't do this last time, so I got these slides up for you. This is on a cross section. This is on a longitudinal section. We'll try to show you a good longitudinal section. But your biggest clue that this is smooth muscle, see these really long nuclei? Those are very, very typical of smooth muscle. Also, you have no striations. So, long nuclei, no striations. It's a fairly good bet that you're looking at smooth muscle. This is more typical of what you have on your slides though. So what type of tissue is this?
Smooth muscle.
Dense irregular. Your best bet is dense irregular. Right. This is your smooth muscle. Your very long, elongated nuclei. Generally, there's only one nuclei per muscle cell of smooth muscle. That is not true of the other two muscle types. So this is skeletal muscle. Right away you notice stripes, all right? Each stripe is a specific structure, but you are only responsible for a Z-line. A Z-line occurs within the light striation. So if a pointer is pointing there and asks you what is the structure, you're going to say Z-line. Okay. If you look at the nuclei, they are usually on the periphery of the cells. You will find a few, in the middle, but for the most part, this is very unlike smooth muscle. They're always pretty much towards the edges. This is also a different stain for skeletal muscle, and we have those back there. It is better to see the striations. So if you haven't looked at a black and white one, a skeletal muscle, make sure you look at one. This is cardiac muscle. And its biggest difference are your intercalated discs. So if you see these lines, those are intercalated discs. They are junctions that allow the wave of depolarization to travel through the heart without having to start and stop. It also has striations, and it is what they call branched. So if you looked at your skeletal muscle, there was pretty much parallel fibers. Your cardiac is not that way. It tends to branch, but your biggest thing you're looking for are those intercalated discs. Again, this is more typical of the slide you have. This is an intercalated disc. See how small they are? But you need to look for them. If you're seeing striations, the next thing you look for are intercalated discs. Comparing them. So what is this? What type of muscle? Smooth. What is this?
Cardiac.
Cardiac. You see your intercalated disc. And so the last one? Skeletal. You are responsible for looking at two different slides of for the nervous system. So the medullated nerve fibers have no cell bodies. They are the fibers. They are the axons of the nerve. The cells that you're seeing are the Schwann cells. They are responsible for making the myelin that surrounds the nerve, the axons. Your little indentations are what they call nodes of Ranvier, but you don't need to know that now. What you do need to look at is the second slide, which says Nissl bodies. Nissl bodies will contain the cell bodies, which are these typical star-shaped cells. This is a really perfect example of a neuron cell body, but what you got are these things down here. All right? So, what you can see is that there is a nucleus. It's generally centrally located. But anything outside the nucleus, any little dot spot outside the nucleus, is a Nissl body. Nissl bodies are the rough ER of a neuron. Neurons make a lot of protein because they must be able to continuously conduct a wave of depolarization, so that requires a lot of protein. All right? This is bone. Nothing looks like bone. Bone have these nice concentric circles. The concentric circles plus the Haversian canal, the central space, is called the Haversian system or osteon. Either one of those is acceptable on your practicum. Each bone cell is contained within a lacuna. Because of the way that they make the stains that they use for the bone, to make bone slides, the osteocyte is usually burnt out, so all that's left is the lacuna. That's not the same on your bone model. On your bone model, you have spaces. The spaces are your lacuna. You also have these spider-like cells. Those are your osteocytes. All right? So make the distinction between the cell and the model. Each circle is a lamella. If it is attached to a Haversian canal, it is part of a Haversian system. If it is not, it is an interstitial lamella. So those are what's left of bone after bone has reorganized itself. So your bone is constantly building up and breaking down, but it does not get rid of the old tissue. Instead, it builds around it. So between your concentric lamella, you have interstitial lamella. The little lines extending from the lacuna, where the osteocytes would be, are called canaliculi. They are moving towards the Haversian canal because that is where the blood vessel is. That is where the nutrition is coming from. So those are little lines, contain extensions of the osteocytes. But the canal, the space itself, is a canaliculi. What's this? Smooth muscle. Look at the nuclei. They're very, very elongated. Doesn't look like dense regular. Then what's this? Dense irregular. Put them all together. What's this? Dense regular. Look at the cells. They're very small, which means they are not cartilage and they are not muscle. So what's this? Fibrocartilage. Look at the cells. They have space around them. That's a lacuna, which means you're dealing with a chondrocyte. So the one cartilage, which is very, very regular because it must support a lot of structures, is your fibrocartilage. Where do you find fibrocartilage? Meniscus of the knee. What else? The intervertebral disc. So yes, you can ask you location. So for all of your tissues, it will give you location. So look at the locations of where you find them. What is this? Nope. What? No? No? Those are medullated nerve fibers. So, line up all of your pictures. Make sure that you can tell the difference not only between the same types of tissues, but different types of tissues, because they can look awfully similar under a microscope when you've only got a minute and a half to look at them. Okay, so be very, very exact with what you're looking at. So what's this? Smooth muscle. Okay, see how all of those look somewhat similar, but each one comes from a different tissue, a different type of tissue. So going back to this is his favorite tissue. This is pseudostratified ciliated columnar epithelium. You will probably see this somewhere on your exam. Some type of question. This is your simple columnar. So these are cilia, right? And what's on top of here? Microvilli. Somebody asked me about Wormian bones and Wormian sutures. The skull cap that usually had the most of them, because it kind of looked like this, is missing. I have the feeling Hampton has it. But there is one skull that has one little Wormian bone. The joint between the Wormian bone and the rest of the skull is a Wormian suture. So be careful what the question's asking for. Is it asking for a feature or is it asking for a bone? If it's a bone, it's a Wormian bone. If it's a feature or a joint, it's a Wormian suture. That's it. You have the rest of tonight, 207.